This presentation will discuss the aging esophagus. The esophagus is a muscular tube, about 25 centimeters long, with three regions: cervical, thoracic, and abdominal. The esophagus traverses the diaphragm, where the lower esophageal sphincter (LES) exists, and can be a key area for age-related conditions. The sensation of food getting stuck in the esophagus needs to be interrogated as to whether the symptom is produced by solid foods alone, liquids alone, or by both food consistencies. How do you think understanding the type of dysphagia produced by food consistency helps you in your differential diagnosis? Similar to the rest of the GI tract, the esophagus has four layers: the mucosa, submucosa, muscularis propria, and either an outer serosa or adventitia. Age does not change the esophageal histology per se, but different diseases can lead to changes in the epithelia, such as dysplasia due to gastrointestinal esophageal reflux, or eosinophilic infiltration. The location of mucus glands within the submucosal layer is actually a unique feature specific to both the esophagus and the duodenum. The mucus is excreted through ducts that reach the mucosa's epithelium in order to help lubricate the surface. These ducts typically have a cuboidal or stratified cuboidal cells. With aging, the use of anticholinergic medications such as diphenhydramine or Benadryl can reduce the amount and quality of saliva and mucus that can contribute to swallowing problems. Esophagitis or esophageal damage can be caused by medications taken by older adults, such as bisphosphonates for osteoporosis and aspirin for prevention of cardiovascular events. Be sure that your older adult patients drink enough water after swallowing their pills to assure proper passage to the stomach. The esophagus has an inner circular layer of muscle and an outer longitudinal layer of muscle. Between the inner and outer layers of muscle, there is also a network of nerves called the Eurybatos plexus or myenteric plexus. The propagation of a food bolus depends upon the peristaltic reflex. Stimulation of muscles occurs through effects of transmitters such as acetylcholine and neurokinins such as substance P and substance K. The intrinsic primary afferent neuron also stimulates descending inhibition in the receiving segment of the intestine distal to the bolus, and this effect is mediated by inhibitory transmitters such as VIP and nitric oxide, NO. Aging causes a decline in nitric oxide production. With age, a rare but troublesome condition may develop called jackhammer or corkscrew esophagitis. This condition is hypercontractile peristalsis associated with esophageal spasms that may mimic angina. What does the medical literature say about treatment of jackhammer esophagitis? Histologically, there is no well-defined thickening or muscle that controls the LES, thus the LES is considered a physiological or functional sphincter. When the LES fails, the body transforms normal stratified squamous cells of the lower esophageal lining into a mucus-secreting epithelium with simple columnar cells, which are better at protecting itself from gastric acid. The prevalence of GERD among the elderly is about 23%, but studies demonstrate similar prevalence of GERD among older and younger age groups. However, severity of GERD and its associated complications, such as Barrett's esophagus, severe esophagitis, ulcerations, and strictures, are more prevalent in older adults. The term presbyphagia describes physiologic changes in swallowing that increase the risk of dysphagia and aspiration in the elderly, especially during acute illnesses and other stressors. When older adults complain of food being stuck in the chest, you need to think about anatomic, neuromuscular, inflammatory, or infectious reasons for this symptom. Mechanical obstruction can be caused by esophageal changes, such as strictures or tumors, or compression from surrounding tissues, from vascular enlargement, or mediastinal masses. Neuromuscular causes include achalasia, scleroderma, or diffuse esophageal spasm. Finally, inflammatory and infectious causes of dysphagia include eosinophilic esophagitis and candidiasis.